Hello, my name is Rob Colloway. I'm here to explain to you the key function on the scale of function, which is called neuromuscular balance. Okay? So this is a concept that is mostly misunderstood, and people have just missing this whole step when they're rehabbing certain people up to proper function and optimal function. Okay, now it goes about neuromuscular balance, as you can see here. It has to do with the nerves, it has to do with muscles, and they hold a certain tone and balance, especially of the structure, which is the joint. Now the best example of balance, I'm going to do a little illustration. I got a little circle here. As you can see, it sits over my button. And the rubber bands are basically the muscles that keeping this circle right in the middle. Now, if any one of these muscles is just not working right, this will happen. You notice that the structure is now sliding over to one direction. Most commonly, the other muscles will now work harder to prevent the slide. However, the slide has occurred, which then causes all kinds of misalignments, higher muscle tone in other functions, and imbalances that occur within the body. Okay, now this concept is very crucial, because if you don't have proper balance, you constantly have an instability. So that causes instability in the joint. Further, it can create that the nerves are on one side of the body firing really hard. For example, the biceps muscle, the nerve is firing very little, and the triceps is firing really hard. So that means the triceps doesn't want to let go, so you can bend your arm. And it appears that you now don't have the tone or flexibility, but this is actually a balance issue, which comes down to, proprioception and lack of neuromuscular control around the joint. Further, balance deals with proprioception. What is your position in space? Now, ask somebody to make a somersault, you see him going left, going right. So you have the concept of body position in space also in this key function. So that addresses neuromuscular balance. What to do about it is actually quite simple, but you need to know your body, so consult your physical therapist, and thank you for your attention.